Hi everyone, my name is Emily Bagretawetabee. I am here to talk about people with disabilities and the cricket, this adopt is production. The guest today is Tom Wilson. We are going to discuss about people with disabilities and their cricket during COVID-19 pandemic.
Yes. Hi, Emily.
Hi, nice to meet you.
Yes. Do you have some questions for me today?
Yes, please. I'm going to ask you one. How have people with disabilities fared during this pandemic?
This pandemic has been hard on everyone, but people with disabilities have suffered more than most. People with disabilities tend to live sometimes more isolated lives, and people with disabilities who have been stuck in institutions weren't even able to get visitors during the pandemic, right?
Yes.
And that's a kind of a sad state of affairs. And people with disabilities have been discriminated against when it comes to both getting health care.
That's true.
And in getting the vaccination. And people with disabilities have been a big percentage of the people that have died in the pandemic. And we'll talk a little bit more about that. But this pandemic, like they say, it's been shows the discrimination in society. They talk about how deaths have been higher in the black and the brown communities. But in the disability communities, the deaths have been extremely high. And it shows that people with disabilities face barriers that other communities don't sometimes.
Oh, that's good. Okay, my second question is, what issue have people faced during the COVID-19 pandemic?
Okay, I'll go into some of the same things I was talking about, but in nursing homes, and I'm going to talk a little bit about Illinois because I know Illinois better than the U.S. as a whole.
Yeah.
Over 10,000 people with disabilities have died in nursing homes. That's a very, very high percentage. There's only about 110,000 people in nursing homes in Illinois. And so that's like a 10% death rate in the nursing homes. And the people in the nursing homes often were forced to die without their family members present. They often didn't get good health care treatment. And there was a lot of fear. If you were in a nursing home, you knew that you were in danger, and you knew that there was not much that was being done to save you. Nursing homes have always had problems with doing infection control. Even before the pandemic, too many people die from contagious diseases. And the nursing homes are, you can't socially distance in a nursing home. I have one friend who was in a nursing home during the pandemic, and she said that her bed was so close that if she reached out across and the person in the bed next to her reached out across, they could touch hands. And oftentimes people are 2, 3, and 4 people in a very small space in a room. So this made them an extremely dangerous place. And one of the things that ADAPT and some other disability rights groups did was to say really early on, way back in last April, that this pandemic was a threat to people in nursing homes and that they needed to evacuate people. And one of the demands was to only put one person per room so that they would be safer. You know, the disease, the only people who could visit the nursing homes were the workers, right? Mm-hmm. So the disease was all coming in with the workers, and they really needed to be more careful about testing people. They needed to make sure they had enough PPE. I heard stories about workers not wearing protective gear in the nursing homes.
I want to ask you, what is okay, you can keep on.
What is PPE?
Yeah.
The protective gear includes things like a mask. It could include a gown. It means the gloves that would cover your hands. You know, there's other kinds of protective gear that people can wear too to help stop the spread of the disease. And the nursing homes didn't have enough of this. We said that some people should be evacuated to lower the density in the nursing home. And at the first part of the pandemic, as you know, there were hotels that were completely empty. You know, they could have put people from the nursing homes in hotel rooms and brought in help. Some people need some nursing care, and they could have saved a lot of lives if they'd been able or willing to evacuate people. ADAPT actually did letters to the governor. We did call-in days. We did a protest at the governor's house here in Chicago, and yet they ignored all of our demands to save people in the nursing homes. And out of ADAPT's work, another group that was formed, and I'll talk a little bit more about it later, was the Institutional Rescue and Recovery Coalition, which includes about 20 different groups from around the city, around the state actually, that wanted to protect people with disabilities. So that was one of the problems. We also know that some politicians in this country said that we shouldn't shut down the economy, that we shouldn't do anything special, and that older people and people with disabilities should just go ahead and die. And they were very cruel. One of the lieutenant governor in Texas was quoted as saying that. And that kind of attitude was inhumane. People with disabilities were discriminated in getting hospital beds. In some places, they were just saying if you had a cognitive or a intellectual disability, that they weren't going to treat you if you came down with COVID. And that's discrimination. Under the laws of the U.S., the triage should be done by the severity of the disease and your likelihood to survive. So people with disabilities were being undervalued, devalued, just because they had a disability, and that was a form of discrimination. And even now, as the vaccine was rolled out, while nursing homes were one of the first targets after healthcare workers, even to this day, there are people in nursing homes who have not gotten the vaccine. And there's still been deaths in the nursing homes, even after them being some of the first to be supposedly vaccinated. So we know that this pandemic has been really hard on the lives of people with disabilities. It's exposed discrimination. And, it also, people with disabilities in society, they often work. Well, some people have been able to do remote learning, and then some people have had to do their jobs at their usual location. And if you had a pre-existing condition or an underlying condition that made you more vulnerable to the virus, that meant that you should have been working at home, right? Or given some sort of accommodation. But even here in Illinois, they were trying to make state workers go back to work who had these conditions like diabetes, asthma, COPD. Those conditions made you much more likely to die if you got COVD. And teachers also had to battle to protect themselves because they wanted to throw them back into the schools without the protections that they needed to stay healthy.
Yeah, for me, what I know is why they told them to go back to school, because some parents, they didn't want to be responsible for their children.
Yes, we know that getting instruction at home is hard and that not everybody has the Wi-Fi that they need to do a good job. But I think we have to put human lives ahead of everything. Okay. And we don't want to sacrifice anybody to this disease if we can do something about it.
Okay. So, number 3, what happened to people with disabilities in nursing homes and congregate settings during this long lockdown?
Yes.
What was it like? Could they leave the state remedy bad situation for residents in nursing homes?
Yeah, here in Illinois, we currently have about 23,500 deaths in Illinois. Okay. Out of the people that have died, over 10,000 of them have been in nursing homes, and some others have been in congregate settings like state developmental centers. And those deaths are, way out of proportion to the general public. And so that was the area that was most dangerous, most deadly, was a nursing home. And the state, while eventually one of the things that happened was this. The nursing homes have always had inspectors called ombudsmen that would come and to monitor the conditions in the nursing home. During the pandemic, they were not, the ombudsman were not allowed into the nursing home. So if a person was facing a terrible situation, mistreatment, they couldn't even talk to an ombudsman because they couldn't visit. And the nursing homes also, the governor gave them a reprieve from liability, so that if you died from COVID, that your family could not sue the nursing home, even though they may have been getting improper care, that there was short staffing, that they put these people in a dangerous situation knowingly, and didn't do everything possible to keep people alive and to stop the spread of the disease.
Wow.
So
Interesting.
yeah, the nursing homes have been a terrible place, and most recently down in Anna, Illinois, there's a state-run facility called Choate, and some of the staff there have been accused of abusing the residents, and again, there was no oversight, no inspection because of the virus, because of the COVID virus. And people have died in that facility because of staff
How many people
abuse.
died?
Well, in Choate, I think it's been, well, I'm not sure I have the right number, but it's been at least a handful of people. But like I said, in nursing homes, it's over 10,000 people in this state.
Yeah.
And other congregate settings where people are forced to live real closely have also been dangerous places. Prisons have also been dangerous, but the death rate in nursing homes is way more than the deaths in prisons.
Wow. Okay, number 4. How did the state help people with disabilities who use home service program to meet their care needs?
Mm-hmm.
We are people able to get PPE for themselves and their home care workers. What was it hard to get needed one care?
Well, we had a show not too long ago here on ADAPT Productions about a group called PPE for HSP. And PPE is the protective equipment and gear that people need to be close to each other and work together. And HSP is the Home Services Program, which is home care rather than institutional care. And in the disability community, we've always supported the idea of doing home care much better than institutional care. It's safer, people are happier, and people live longer. We know that through much research. We know that that's the preference for most people, and it's better for them. Well, in this situation, the state should have been providing that protective gear, but they never did, and so the group HSP, I can't say it, PPE for HSP, they got volunteers together. They sewed masks, they got together gowns, they got together protective gear, and helped distribute it all around Cook County to help people who are working, the home service workers, to make sure that they had this gear, and to make sure that the people needing care, the consumers of the home services, were also getting the protective gear. And they also did some advocacy with the state, trying to tell the state that this is their responsibility. They need to help take care of these folks. Well, the percentage of deaths in home care has not been high, but they could have done a better job with doing the protective gear. And the state was, I would say, not as responsible about their care responsibilities as they should have been. So that we've been very critical of the state in that regard, that they needed to do a better job. So that program is also now working on some legislation, and they're saying, this may not be the last emergency that people with disabilities face. And at the national level, we have FEMA, who is the agency that handles emergency. Well, the state has an agency called IEMA, and they're the ones that are supposed to do disaster preparedness. Well, nothing in their playbook, so to speak, really is ready to address all the issues that people with disabilities face. So they're trying to get a law passed this legislative session that would create an advisory panel of people with disabilities to make sure that the people who work on emergencies know how to handle that.
Oh, okay, that's very good. So let's go back to the what is the difference? What is institutional care?
Institutional care is when people live in concentrated in one building, and that they are not free to leave necessarily when they want to, that they have to eat the food that's given to them, that they don't have a choice in that, that they don't get to choose necessarily their roommates, and that it's like where in a nursing home, for example, you might have a wing of a nursing home where there's 40 people, and there might only be 2 people, care workers, assigned to that 40 people. So you only get the care that those 2 people can provide. And when you're talking about home care, which was the alternative I talked about, it's one-on-one. And I know people who get, 10 hours of care one-on-one a day, and that's, for most people, that's enough care, or some people need less than that. But the home care is one-on-one. The person lives in their own home. They can decide when and what they want to eat. They can go out and come back and forth when they want. They can go to the movies. They can live their life with some freedom. And institutions take away a lot of that freedom.
Wow, that's so interesting to take away somebody's freedom.
Mm-hmm.
Okay, number 5. Have there been problems with getting healthy care in this period of concern for more patients than bed in hospitals? Did people with disabilities get good care and equal care? What is TRID?
Okay. Many hospitals at some points during the pandemic were overwhelmed, and that meant that they only had services in their intensive care units for people with COVID. So a lot of surgeries and a lot of other treatments got postponed, including cancer care. But some people with chronic disabilities need to have ongoing medical treatment, and they had a hard time getting appointments. So that was a bit of a problem. And then, like I said, when people with disabilities actually got COVID, sometimes they were denied care because of their disability, and that's a really bad form of discrimination. And an agency that helps defend the rights of the disabled here in Illinois, called Equip for Equality, they made sure that the governor put out a proclamation saying that you can't discriminate against the life of a person with a disability just because they have a disability. So that some of these hospitals had to change their policies to protect people with disabilities.
How about okay, that's good. How about because I used to see people with disabilities where they are sick of COVID-19, but some of the doctors had to remove their mask and then give it to somebody else, so that they can be survived.
Yeah, see, if that person had a chance to survive and they took the respirator and gave it to somebody else that didn't have a better chance of surviving, that's a form of discrimination. They sometimes have devalued the lives of people with disabilities. They need to have the same access and the same right to live as anybody else. And when you say that a person with a disability doesn't deserve the treatment, that's a form of discrimination.
Okay. You already answered how many people have died. You already answered that.
Yes, it's over 10,000 in Illinois,
yeah,
in nursing homes. And in Illinois overall, we have about 23,500 who have died. And people are still dying, even though we're more than a year into this pandemic. So I really want to encourage people to get their vaccinations. And people with disabilities are having trouble getting their vaccinations too.
I think, yeah, you are right. I think they should have their own hospital in order to have to be vaccinated.
There can be special hospitals, like, there's Shirley Ryan, which is a rehab hospital for people with disabilities. But you need to have equal access to all hospitals because not everybody can go to a rehab hospital.
Okay. Number 7, have people with disabilities been able to get vaccinated?
you know, that's been a problem. You know, they had the rating system, the 1A, the 1B, the 1C. Supposedly in Illinois now we're in 1C. But people with disabilities living in the community were put in the 1C category. But in reality, if you had suppressed immune system, if you had asthma, if you had other breathing issues, if you had diabetes, if you were obese, you know, let's say maybe you're fighting cancer, all of those conditions should have put you in 1B. And our governor did bump people up into 1B with disabilities, and I give him some credit for doing that. But in Cook County and City of Chicago, our Cook County Board President, Tony Preckwinkle, and our mayor, Mayor Lightfoot, they would not move people into the 1B category. So we saw that in the city and the county, we should have done better, but they did not boost the vaccine opportunities for people with disabilities when they should have.
Okay, number 8. Are people with disabilities valued? What political views of disability have surfaced in this emergency? Mm-hmm. How this emergency taught our public health system and emergency preparedness agencies anything about safety for people with disabilities?
We talked a little bit about some of that, but the disability community has been very vocal about the deaths in nursing homes and congregate settings. And I think without the activity of the Institutional Rescue and Recovery Coalition, without ADAPT, without these protests, the media would not have even covered it. So the media was covering other problems and other forms of discrimination, but they were slow to catch on to the many deaths in the nursing homes and the mistreatment of the disability community. And I think that needs to be looked at, because that should have been more out in the open, more presented. And so there's still room to improve in telling the disability story in the whole community. And, you know, we know that, again, like I said, there was not a lot of preparation or knowledge, or, you know, when it comes to emergencies, people with disabilities have often been left out. Going way back to the Hurricane Katrina in New Orleans, the people who often died there were people who had mobility issues that couldn't leave and drowned in their own homes. And there were whole nursing homes where they were never evacuated, and everybody in the nursing home drowned. So states and counties and everybody needs to have disaster preparedness that takes into account people with disabilities.
Oh, okay. Have workers with disabilities been able to protect their health? What does it mean to work properly if you have underlying conditions that make you more vulnerable to serious disease and death?
Yeah. Not every person with a disability has an underlying condition that makes them more vulnerable. But many people with disabilities do have underlying conditions, and that has not been addressed very well. So people with disabilities, as I mentioned earlier, were often forced to go to work when it was a danger to them because of their underlying condition. And that's something that we should have listened to. I think the public health experts would tell you that if you got an underlying condition, you needed more protection. And that might mean that you change the way you do your job, or make sure that you work remotely. Many jobs can't be done remotely, but many can. Mm-hmm. And those are adjustments that we did some things well, but other people were not given a chance to do that.
Yeah. Okay. The last question: what is the institutional rescue and recovery solution? What is the PPE for HSP group?
Yeah, I mentioned those groups earlier, but these are two groups that were formed during the pandemic by activists in the disability community. in order to try to straighten out the problems that so many people with disabilities faced during this pandemic. And the Institutional Rescue and Recovery Coalition has been doing something very unusual. They've been organizing people in nursing homes. That's been very hard to do because you can't even visit a nursing home. But we had a march that went down Sheridan Road up in Rogers Park, and there's like 7 nursing homes in a row there. And sometimes people in the nursing homes are able to congregate in a fenced-in area by the nursing home. So we've been able to talk to people that way, or to get contacts and call people if they have access to phones in the nursing home. And through those contacts, they've been able to organize a group inside the nursing homes to tell the story about how they've been mistreated and often left to face the pandemic in conditions that no one should have to face.
Oh, okay.
And the PPE group is continuing, as I said, and that group is, like I said, also trying to address the short-sightedness of the emergency planners, that they don't have good programs for people with disabilities. There have been other disasters where the electricity goes off, and people who are on respirators, if they don't have electricity, they can die, right? The PPE for HSP group has continued to advocate for the state for people to get the equipment they need, but they've also started doing advocacy with the legislature to try to make sure that we have access, that the voice of people with disabilities are included in disaster preparedness and planning, and that's been a shortcoming in the past. So people with disabilities need to be included. There's a saying, nothing about us without us, and people with disabilities need to be heard so that they're not left out or left behind in disasters again. So those are some things that the pandemic has created new advocacy efforts to help save lives for people with disability into the future.
Okay. Thank you for coming, Tom. I hope we enjoyed the show.
Okay, thank you.
See you next time.
Thank you for all your questions, Emily.
Thank you. Come.
Bye.
See you all next time. Thank you for coming.